My name is Kevin Maund. I'm originally from Far North Queensland, around the Innisfail area. Mamu language speaking group, Warrabara man. I work for Kabingai Youth Development on the north side at Zulmia. My role at Kabingai is the Indigenous Community Links Coordinator and also Senior Program Coordinator. The role is very simple. It's basically, as it reads, linking community into services that they may need around the area. A family man now. Obviously, when I first moved to Brisbane, I met my partner here. I got two kids, so that's probably the bulk of my time, spending time with my family, but also involving them in a lot of our community activities that we have. Anything to do with the Kabingai that's run out on the weekends, the local men's groups, attending barbecues or days, the Murray Christmases, the NAIDOCs, these sorts of events. But then on the outside, we try to get a bit more sport and recreation into our life. So walking, fishing, doing family, healthy activities like movement activities such as tennis, or I've even tried Zumba with my partner. But really, yeah, just becoming more active.
So my name is Josie and I work at Morden Aches Deception Bay Clinic. I'm a care coordinator for the Care Coordination Supplementary Services. Morden Aches Deception Bay Clinic is a Aboriginal Torres Strait Islander community health service, and patients have access to general practitioner, nurses, dietitian, optometrist, dentist, and access to visiting specialists.
Yeah, so I first heard about the Care Coordination and Supplementary Services program through my brother Ian. He met Johnny Gill through his doctor. Because I work in this sphere of community, finding out, needing to know what's going on with everything, it helps a lot. So that's where I first heard of it. I approached my doctor, and then that's when we made the call through to Johnny Gill's team, and they got us onto it, yeah. Services I access through the Care Coordination program is my CPAP machine, so my snore machine, and then being able to have access to the care coordinator who's at the Deception Bay clinic facility, and also through the clinic out here at D Bay is I get to see my doctor, podiatrist, dietitian, sorry, I'm going to go through them, optometrist, and dental. Yeah, dental's the other one. So it's a one-stop shop right here on my doorstep. You know what I mean? Once upon a time, I'd have to go to 6 or 7 different places for all of these services. I can attend every single one right here on my day.
So Kevin accesses through us, sees the GP, sees the nurses, and he comes in every so often for his CPAP machine, which he uses for his sleep apnea, and he gets that downloaded with the assistance of myself and our regional coordinator. Also, he'll come in and get his blood sugars checked and his 3 monthly blood test for his blood sugar levels.
The services that I get through the Care Coordination is obviously the CPAP machine, but then the stuff that comes through from Johnny is being able to understand what happens, like your hypopneas, your hypermnias, where you have blockages. There may be leaks through the nighttime. All that information is given to you, so I get to meet with Johnny on a regular basis between the 1 to 3 month mark, where we go through all those details. I bring him my computer chip, and he can give me all of that information across that. Everything's in one place for you to be able to get here. You're not having to take 6 or 7 different times off throughout a day to come and see someone. I can come in the morning, see my doctor, get a blood test, see the podiatrist, and go. And sometimes it varies in different ways. That takes strain off my family in the way of I don't have so many appointments away from those guys. It also takes strain off my work. I don't have to take many engagements away from there as well. The access and the education is the biggest part, and what I'm finding now is we can come into the service as a family, and my son knows everybody here, my partner knows everybody here, and they feel warm and welcome, and they know, I come in just the other week with a gentleman, and he said, "You know everybody here," and that's what you want. That's what you want to be able to do. Have that friendly family environment, and know that you're safe with your health, and just with your contacts and your visits and stuff. You know, so it's very professional, and it's all right here.
My ultimate goal is for all my clients to be like Kevin, who are very proactive within their health. He started off by needing this service, but he's really taken it on board to himself to self-manage his chronic conditions. So really, he doesn't really need to use me so much at all, and that would be my ultimate goal for people in this community to not need me at all.
So the best part about the care coordination service is access to the CPAP machine, and then coming in and sitting with Johnny, and we go through all of the information that we have, so the hypopneas, the hyperpneas, the education stuff around that, and finding out that information was really helpful. The stuff that I do outside now, again, it's been a lot of the learning and the education. It's funny, we see all these different services, podiatry, optical, dental, and you think, well, they don't tie into each other, but they do. I have a conversation with my dentist, and they want to know what's happening with my diabetes. Have the same conversation with Johnny and Joe with the CCS program, the care coordination program, and they also want to know what I'm doing because it all ties in. And vice versa, the doctor will ask me, how's my CPAP machine going? So across the service, there's a sharing of information that helps everything that I do, and that then informs me to make those other choices. So if I had a message for, Aboriginal and Torres Strait Islander men out there around their health and their care, it would be to make sure that you get to a doctor first off and see them. It's not that scary place that it's meant out to be. I know when I was younger, there was a period of time where I probably hadn't seen the doctor for about 10 years. I'd only go to the doctor when I was sick, and that seems to be the stigma around it. You've got access to 715, which means you can get a free health check every year. We need to get and do that. And then from there out, if there is anything wrong, it can be helped out. And you've got these great facilities and great people that can help that. So have a regular checkup, service your body the same way you service your car, and make sure you get in and use these facilities. They're here for our mob, and make sure that we get in and see them. That'll be the message, yeah.